When people ask me what I do, usually I just tell them I put labels on boxes because that's all they think I do. But when people ask what I really do, I usually tell them that I work to educate people around how to use medicine safely, and I also help them feel more confident with how they use medicines and manage all those little problems in life that they don't necessarily want to see a GP for, or that the GP is not available for them to see. I think in the NT our pharmacists do face some really unique challenges. We're a much smaller workforce compared to other areas, so we often are underrepresented, but at the same stage we have significant health disparity in a lot of our patients out here, and our health system really needs to be boosted up to meet the needs of our communities. But to me, that's the real opportunity of practicing up here, because there's so much work to be done. Often it's only you that's leading the charge. I think the issues that I'm most passionate about in pharmacy really involve the patients that I consider aren't getting the level of care that I think they deserve. So I feel really passionate about people who don't have access to healthcare like urban people do, so rural and remote patients, but also people who are, say, on the opioid pharmacotherapy program, or who have low health literacy, or who just generally feel isolated within their community. I feel really strongly about going out, reaching out to those people and trying to get them to engage with us in a more honest way and really let them know that we're here to support them. So I really think that developing that relationship is what lets you be the most effective pharmacist that you can be. To me, career highlights have always been things like being able to present the Pharmacist in 2023 report paper in Canberra in the first PSA in Parliament session. I felt really honoured to be up there to represent early career pharmacists, and particularly to represent the Northern Territory and a lot of rural and remote pharmacists who don't necessarily feel that they get recognised. Professional highlights, look, I really can't go past just simply having people call up and know that I'm the one on the end of the phone, that they trust me and that they're going to listen to the advice that I'm going to give. So having patients who might live 2 hours out of town call up for a minor symptom, and then they ask my advice, they feel more comfortable with how they're going to go forward, how they're going to look after their children, for example, and just knowing that they feel reassured, I honestly, that makes my day. I definitely think there's an importance in our profession right now. So we've seen that already with coronavirus, and pharmacists have really stepped up to deliver a lot of services and practice in these new times. And I think pharmacists are going to play a bigger role than ever, because we're dealing with more complex medicines, and we're dealing with a health system that really needs pharmacists to improve their clinical skills and deliver more face-to-face care and be problem solvers rather than our traditional supply-based models. As the first Territorian to win this award, it's exceptionally humbling. I'm incredibly proud to be from the NT, and I think that there's a lot of really good work that NT pharmacists do. And for every one of me that's doing this and getting the award, I can name 10 other pharmacists that I know that are doing equally as good work and deserve to be awarded as well.
Sam has delivered a range of educational sessions for community members, health professionals and pharmacists, and delivers training for Aboriginal health practitioners on medicine safety and quality use of medicines. He is a strong advocate for enhancing pharmacy in the NT. Congratulations, Samuel Keitaanpaa, 2020 Early Career Pharmacist of the Year.